In this video, I will present my consideration on affordable methods of rejuvenation to extend our lifespan to maybe 1,000 years. As always, I recommend you to download the presentation as PDF file from the links in the description, so you can make your own research and decide am I right or not. Please mind that I am not medical professional, and I have PhD in physics and mathematics. I'm a professional scientist, and this research I do for my own rejuvenation and extension lifespan. Okay, let's go into details. Stiffening of blood vessels leads over time to chronic hypoxia, which is a deficiency in the amount of oxygen reaching tissues. Age-related chronic hypoxia of tissues is a factor, is maybe main factor, that can influence cellular aging and the senescence of cells, including immune cells. Hypoxic conditions increase the production of reactive oxygen species by mitochondria. Elevated reactive oxygen species levels can damage mitochondria and other cellular components such as DNA, proteins, and lipids, contributing to the onset of senescence in cells. To reduce the damage, cells undergo metabolic reprogramming, resulting in increased reliance on glycolysis in the cytoplasm rather than oxidative phosphorylation in mitochondria. Eventually, under high oxidative stress, cells may cease to divide and produce pro-inflammatory secretory profile, referred to as senescence-associated secretory phenotype, which is also known as inflammaging. Okay, so you see that again, I believe that arterial stiffness and it is how vascular aging is manifested, and it is core cause of aging and short lifespan in humans. The chronic hypoxic microenvironment can promote a pro-inflammatory state which is linked to senescence. Chronic inflammation of tissues itself can induce senescence in healthy cells through the effect of cytokines and other inflammatory mediators of the SASP produced by senescent cells. Additionally, hypoxia can suppress autophagy in cells, a process crucial for cellular homeostasis. Impaired autophagy can contribute to the accumulation of damaged organelles and proteins, promoting senescence in more cells. Also, non-steroidal anti-inflammatory drugs have minimal effects on senescent cells. They significantly extend the lifespan in mice by reducing adipose tissue inflammation. So, okay, it's anti-inflammatory drugs can actually reduce inflammation and then extend the lifespan. Applying senolytics can lead to the partial removal of senescent cells, reduced age-related inflammation, and prolongation of life span across the different animal models. So also it is demonstrated. So again, there are some senolytics. The most safe is fisetin, but also there are other combinations, and so the idea is to remove intermittently apply senolytics and remove them like every month or every 2 months, and then to get to slow down aging. Because senescent cells primarily use glucose as a source of energy, reduced blood glucose levels due to the change to a ketogenic diet and the use of medications such as metformin and berberine reduce age-related inflammation, promote autophagy, eliminate senescence of adipose-derived stem cells, and attenuate osteoarthritis progression. Okay, so you can read it again. It is ketogenic diet is very healthy. Also, you can watch again my videos and read presentations on this subject. In my video, that's in another video and presentation, I discussed an interesting program of senescent cell removal by combination of long stays in the sauna, up to 5 hours a day, aerobic exercise, and intake of nicotinic acid, or that's so-called niacin. Don't be confused. Niacin sometimes people use for nicotine amide, which is different from nicotinic acid. So Tom Cruise, who has practiced this program for 22 years, is very active and looks much younger than his chronological age. So you see, it's again, here is, we can see these photos that he is not aging or aging very slowly just by using this program. And this program is actually expensive. It used to be $5,000 American dollars in California, but again, now I believe it can be close to 10,000 American dollars. But he has time and has money, so can afford this program to slow down his aging. I explained the rejuvenation effect of this program by very low blood glucose levels 3-4 hours after the intake of niacin that results in increased oxidative stress and death of malignant cells. Malignant cells, this is senescent cells, cancer cells, and also cells infected by viruses. Watch my video and read presentation on this topic also. Meanwhile, without intense aerobic exercise and sauna, intake of any form of vitamin B3, which includes niacin, nicotinamide mononucleotide, nicotinamide riboside, again, may increase production of senescence-associated secretory phenotype by senescent cells and accelerate aging. Again, what is promoted by some influencers that taken like nicotinamide, which is unstable chemically and expensive, and this actually accelerate aging, not slow down aging. It gives more energy for sure, but it also accelerate aging. So these side effects can be avoided by combining nicotinamide and the nicotinic acid with blockers of glycolysis in hyperactive cells such as ascorbic acid and melatonin. Also, it is known that ascorbic acid in megadoses reduces blood glucose. Okay, so is this what I am talking? This is ascorbic acid reduce blood glucose, but also it is blocking glycolysis and blocking glycolysis and migration of glucose to this malignant cells. So it is very interesting combination. So megadoses of ascorbic acid may reduce levels of chronic inflammation both by reducing blood glucose level and suppressing glycolysis in hyperactive senescent cells. You see that again, this megadoses of ascorbic acid can work and to reduce inflammation. So I discussed the use of some antihypertensive medications such as losartan and I don't remember the name of this. Okay, you can click and watch it. This and minoxidil and some such antibiotics like doxycycline and minocycline alone or in combination of them on maximum life extension in mice. Doxycycline can mitigate systemic inflammation that is linked to dysbiosis in the colon, and doxycycline may indirectly affect senescent cells by reducing pro-inflammatory secretions of this SASP from these cells, which contribute to the adaptive immune system aging, attenuating thymic senescence, rescuing thymic function, or promoting T-cell reconstitution and protecting the thymic epithelium cells from early stages of apoptosis. Okay, so it's again doxycycline. It's just simple antibiotic, which is very cheap actually. At least in Thailand, it is so. It is available in pharmacies without prescription, so it's again easy to buy, and it works like a miracle. I'd say it is very interesting drug. So low dose doxycycline decreases systemic inflammation and improves glycemic control and lipid profiles in mice. Okay, so again, this is quite astonishing effect that the antibiotic works like anti-inflammatory drug. So again, what is interesting, this combination of doxycycline in losartan in mice, that in short-living mice extend their longevity almost 6 times. So you see that this is a control, and the combination of doxycycline and losartan, it's even cannot measure, but at least it's 6 times longer lifespan in some short-living mice models. As discussed in my previous presentation, again, you can watch these videos and read presentation, and combination of certain antibiotics in therapeutical doses, not in low doses, but therapeutical doses. It is 200 milligram for doxycycline, for example. And with mega doses of ascorbic acid has shown potential to reduce the number of senescent cells in specific tissues such as adipose tissue. However, this approach does not uniformly target all tissues in the body, from my personal experience, the first use of this senolytic combination produces a noticeable improvement in well-being. It is really work like a miracle. I was astonished at how much energy and improvement in my well-being was achieved. But then, however, subsequent doses taken 1 or 2 months later tend to have a diminished effect. So it's again, there is explanation that it is removing senescent cells in some specific tissue, like adipose tissue, but in other organs, senescent cells accumulate. Okay, in contrast, non-pharmaceutical approaches such as extended stays in sauna, regular aerobic exercise, and mega doses of nicotinic acid appear to have a more comprehensive rejuvenation effect on the body. This is what Tom Cruise is doing. But again, a good question, can you afford it or not? So it is again commercially available, but what can we do with this? Okay, so this is again some slides from my older presentations, and you see that the vitamin C alone doesn't work. The vitamin C, but if it is combined with some antibiotics, it can, this triple combination, it is azithromycin, doxycycline, and vitamin C can selectively kill senescent cells in some tissues. Like here it is fibroblasts in laboratory cell culture, but also it's in adipose tissues. But again, this was not medical trial, so I cannot recommend it, but I used it on myself with amazing result. But again, over time, the effect is reduced. Okay, this again, instead of vitamin C or together vitamin C, we can use melatonin, because melatonin also blocking transport of glucose to the cells, similar to vitamin C. Vitamin C is more powerful to kill senescent cells, but in combination with antibiotics. But melatonin also can be used. So combining melatonin with these antibiotics and high doses of vitamin C, you see that can enhance treatments for infectious diseases, cancer, and chronic inflammation, while minimizing the long-term side effects of conventional medications. This synergistic approach focuses on optimizing metabolic pathways and targeting specific cellular processes related to aging and disease. This can be a way to affordable method of senescent cells removal. Unlike the targeted action of antibiotics and vitamin C, these methods promote systemic benefits and may enhance overall vitality. It is again, I'm talking about not only antibiotics, but in combination with aerobic exercise or maybe sauna. Okay, that again, but this 5 hours to stay in sauna and do aerobic exercises, it's quite time consuming. So, and such practices require significant time and commitment, which may not be practical for everyone. Okay, when I tell people that for 40 days you have go to sauna and stay 5 hours continuously in sauna and making aerobic exercises, it is crazy. So not many can afford it. Tom Cruise has money, has time, so he can do it. Okay, finding a convenient and universally effective method or drug combination for eliminating senescent cells remains an area of ongoing research. Okay, this is what I try to do. Personally, I follow a nightly regimen which includes mega doses of nicotinic acid, melatonin, betaine, glycine, and lysine, and vitamin C. While there is no formal research or clinical trial supporting this combination, I find it beneficial for improving sleep quality and potentially stimulating the natural release of human growth hormone in my body. So again, it helps. I cannot see overnight any rejuvenation, but I sleep better, and I think muscles grow better. So it's it's easy to use. So additionally, the pairing of ascorbic acid with lysine may help maintain health and also improve resilience against respiratory infections. Again, this is, I think it's very affordable. It's nothing is too expensive of this. So instead of this very expensive rejuvenation therapy, which includes stem cells injections, which again doesn't work, or NMN, which is only accelerate agent, I propose very simple way. But again, I cannot give you advice and a recommendation to follow this way. I try on myself. I am scientist. I make experiments. I use my own body for this test. So, but okay, I see at least slow improvement. So. So again, especially because due to aging, we have growth hormone declines, steadily declines with aging. So an increase in the growth hormone production, natural production of growth hormone is very helpful. And even without nicotinic acid, the intake of glycine improves improves the secretion of growth hormone. It's about 1 hour and a half. So, and combined with nicotinic acid, it can give even more. But again, mind that doses have to be big. Like in this trial, 12 gram of glycine was used. I take really big doses also of glycine. Okay, it is worth noting that rejuvenation effects of such a regimen may take months to manifest. As discussed in my video and this presentation, estimation of aging or rejuvenation can be done by measurements of the pulse pressure. This is the difference between systolic and diastolic pressures, and resting heart rate at least once a week. So at least I can see where I go, because these changes maybe take weeks, not months or years. So then measuring this pulse pressure, necessary correction to the procedure can be done. So maybe I have to add something or remove something or some medications. Okay, so this is a very convenient way to estimate aging or rejuvenation. Okay, also rejuvenation and aging are manifested in changes of endurance. So again, if after this treatment, after this procedure, I feel myself stronger, and I can go cycling, for example, for hours, and that's normally up to 4 hours cycling, quite intensive. So, and I feel not very tired, so I see that endurance and growing. But a problem to measure the endurance. I don't measurements of the pulse pressure is easy, and also resting heart rate very easy. But endurance, I just have feeling, feeling that it is going well. Also, changes in vital lung capacity and visual changes in appearance may take much longer. Okay, it's again the changes in vital lung capacity you can measure with spirometer, and it is I measured it, but it's a little bit more complicated, more time consuming, not always. So it's not always easy to measure, but it also visual changes in appearance. They go slowly because of slow blood circulation, and it can be accelerated with sonar or treatment of skin with some peeling of the skin like this, or some other maybe red, white, or whatever. So it is yet a matter of research. So while the core reason for aging is compromised by blood flow due to stiffening of blood vessels, elimination of senescent cells may contribute to rejuvenation. It is my opinion, my viewpoint. So I see that a core reason of aging is the stiffening of blood vessels. And then elimination of senescent cells may contribute to rejuvenation. If it is, because this works in combination. So you eliminate senescent cells, you reduce level of inflammation, and you slow down a stiffening of the blood vessels. So it is all connected and related. So, okay, but however, further studies are needed to validate the efficiency of these approaches and to optimize strategies for systemic analytic intervention. Big problem for me is that I try to get some support, official support from maybe universities or some health organizations. No, nothing. Even if I apply for a position for very low salary, it is on the level of like I cannot, people don't take me because I'm 67 years old and I'm on the level of professor, not on the postdoc student. So it's again, they need cheap labor, and they just think how to produce these worthless publications, scientific publications. And again, because I'm a professional scientist, I'm quite sure, and my opinion again, that science is almost dead from the end of 80s. This liberal thinking and implementation of this feminist theory and the liberal ideology is ruined the science. So now, and also if I am outside of academic institutions, I cannot even supply an article or have no benefits to submit some article for publication. It is crazy. Again, science is now is a part of propaganda, and it is completely corrupted. Completely, it's not like it used to be. In my young age, I enjoyed to work in science, but the further it is more and more difficult. And again, academic institutions, they hire young people, they hire women, and they hire also some minorities, like sexual minorities and racial minorities. I am male, white male, so I am not supposed to get any job in these academic institutions. Okay, so whatever to say, I don't care. Okay, as I always was talking about, that pulse pressure, changes in the pulse pressure can be used to estimate the age. And my blood pressure is close to 40, and it is like here, and maybe so my age is probably, even if I'm in the best group with well-trained people, my age may be 40. Biological age of my cardiovascular system is probably 45, or maybe even better. But appearance, of course, not so good, so I have to work on it. But again, it takes too long. And this is, we also can estimate age by spirometry, by checking vital lung capacity. And you see it's after age of 20, vital lung capacity is dropping. So my vital lung capacity is even growing a little bit, and it is much larger than in average value for men of my age and my height and body constitution. So I'm quite well doing in this sense. So my vital lung capacity, I measured it 1 year ago, but again I have to find some cheap way of making of this spirometry. It was 5.3, but in my younger age, when I was 18, it was 6.2. So it is less than in very young age, but yet again, I have hope that it will improve over time due to rejuvenation, and it is much better than average. These values like 3.6 liters for men of my constitution, my body shape and height. Okay, so you can go also read some publications. I make these references. And if you want to support this channel and my project, at the minimum what you can do, press like and button and subscribe to my channel. Again, or you can even get my email and contact me, and if you are interested to participate in this research, and okay, so we can discuss the conditions. Okay, so take care and have a wonderful day. Ciao, ciao.